Though piles is one of the commonest complaints, so how do we know it is piles? Fissure is nothing but a crack in the anus. What happens is they will come and they will say that I am bleeding and I took some piles medication and it's been 6 months, but rectal examination is done. We should not assume it to be piles and start. Hi friends, I am Dr. Pinak Dasgupta, Head of the Department Colorectal Surgery at GEM Hospital, Chennai. Today we will be discussing one very common topic, which is the common colorectal problems which we face in our day-to-day practice. So see, most of the patients will come to us with complaint of some kind of bleeding per rectum or blood in stool. So most of the people, they will say that we have piles, but there are many problems which can cause bleeding in stool. So to break that myth and that not every bleeding per rectum or blood in stool is piles, we'll be discussing some common problems which can lead to bleeding in stool. Though piles is one of the commonest complaint, so how do we know it is piles? Basically, bleeding in piles is fresh red color and it is painless to start with. Later on, if you have piles for long duration, many years, you see mass which is coming out on straining while passing motion. Still, most of the time it will be painless, but sometimes it becomes thrombose. The blood inside the pile mass gets clotted. That time it can be painful. Otherwise, it is painless. There is another common condition which many females encounter in the peri-pregnancy period, which is known as fissure in ano. So fissure is nothing but a crack in the anus. What happens is one hard motion passes and we strain while passing the motion, there will be a tear in the anus, and that also will cause fresh blood, and mostly there will be a small spot in the stool. It won't be too much of bleeding which otherwise we encounter in hemorrhoids. The difference is in fissure, it will be very painful. So the common way to differentiate between piles and fissure is, piles is painless bleeding and fissure is pain and bleeding. So this is how. Again, I would like to emphasize on this point that many people, our senior elderly people, many times they will have history of some bleeding in young age, which automatically settle. But now with age, there are other problems which can also cause bleeding. So we should never ignore bleeding. We should get a checkup. So what happens is, many times these people, they will come and they will say that I am bleeding and I took some piles medication and it's been 6 months, but still it is not stopping. So it is very important that with age, or sometimes even in younger patients also, the problems of tumors also come. So in tumors, there will be painless bleeding like piles, but there will be some mucus as well. So many times patient will ignore it, thinking it to be piles, and later on it turns out to be tumor. So we should not ignore this alarm symptom, and always if there is any bleeding, until and unless a rectal examination is done, we should not assume it to be piles and start over-the-counter medications. We should always get it checked so that we don't miss out on important things. There are some other alarm symptoms in colorectal diseases, like change in the bowel habit. So sudden change in bowel habit, or unintended weight loss, or if there is fall in the hemoglobin known as anemia, or if you have, after passing motion, to have the tendency that there is incomplete evacuation. So you have a feeling that you have to go once again. It is not completely empty. So these are the common alarm symptoms which we should not ignore in colorectal diseases.